So guys, previously we have discussed about the axillary artery and its branches, right? So now we shall be discussing regarding the subclavian artery as well as its branches, okay? We shall be focusing mainly on the subclavian artery, okay? Our topic of discussion today will be on the subclavian artery. It will be on the subclavian artery. Now coming to the subclavian artery, guys, if you can look at the picture which I am drawing right now. So all of you know the basics previously which I have discussed, right? I have discussed all the vessels that are emerging out from your left ventricle, right? So watch that lecture first before you watch this. I mean, you have to watch axillary artery lecture first before you watch this, okay? So here we have got a vessel that is coming out in the starting, I told you, right? So what was this vessel, guys? This vessel is your what? Subclavian artery. Now subclavian artery actually passes like this. Okay, subclavian artery actually passes down in this way. Okay, so there are three parts. Even subclavian artery also, like axillary artery as I have discussed, subclavian artery also is divided into three parts. Okay, so this is called as the first part of subclavian artery, and behind, what is this muscle, by the way? This muscle is called as anterior scalene muscle. This muscle here, it is called as anterior scalene muscle. Okay, so this muscle here is called as anterior scalene muscle. Now anterior scalene muscle divides the subclavian artery into three parts. The first part, second part and third part. Second part is behind the scalene muscle and third part is after the scalene muscle. The same way in the axillary artery also, axillary artery is also divided into three parts with the help of pectoralis minor muscle we discussed there, right? So that is the reason why I told you there that pectoralis minor is called as a key muscle of axilla. Why it is called as a key muscle of axilla? Because this is the muscle which is dividing the axillary artery into three parts, 1, 2 and 3. Here what is the key muscle here? Anterior scalene muscle. Why? Because it is dividing the subclavian artery into three parts. Now we shall look at what are the branches that are coming from the first part, second part as well as third part. Okay, now first of all let us focus the branches that are coming from the first part. Let me draw all the branches with a different color. Okay, now let us look at the branches coming from the first part. Now this is the sternum, this is the this is the manubrium, this is the sternum, right? And inside we have got the thoracic cavity. So if you can look at this vessel, from the first part there is a vessel that is coming, right? And this vessel is descending down all the way. It is entering inside the thoracic cavity. It is not coming on to the surface of the ribs, right? It is coming below the surface. From the inner surface of the ribs it is going downwards, right? So this vessel is called as internal thoracic artery because it is going internally inside, right? So this vessel is called as internal thoracic artery, internal thoracic artery. Now from this internal thoracic artery you have got few branches that are coming like this. From this internal thoracic artery you have got few branches coming like this. These are called as anterior intercostal arteries. What are these branches called? These branches are called as anterior intercostal arteries, anterior intercostal arteries. Okay, and this internal thoracic artery will divide into two branches. Okay, so this internal thoracic artery here, this internal thoracic artery down, it will divide into two branches. What are these two branches? One is called as musculophrenic, another one is called as superior epigastric. Okay, so one branch, this one is called as musculophrenic. Okay, musculophrenic artery. It means it supplies your diaphragm. So below here itself, below here you have got the diaphragm like this, right? So it must supply the diaphragm only. That is why it is called musculophrenic artery. And the other artery is named as superior epigastric artery. Superior epigastric artery. Okay, so what is the first branch? So you have to do is just remember the important branch here. Okay, so you just have to remember what is the important branch. So the first branch here is internal thoracic artery. This is coming from the first part of subclavian artery. So let us write down subclavian artery. So subclavian artery has got parts, right? So let us say we are right now discussing about the first part. First part of subclavian artery has got a branch, and that is called as internal thoracic artery. Internal thoracic artery, right? So internal thoracic artery has got three branches: anterior intercostal arteries, musculophrenic, as well as superior epigastric artery. Clear? Next important thing is that from the first part of the subclavian artery itself, there is another branch. Okay, there is another branch that is going up. Look where it is going. It is going up all the way, entering into this transverse foramina, and it is ascending up. On other side also, from the other subclavian artery, it ascends up. It enters into this transverse foramina and ascends up. So as it is passing through this transverse foramina, this is called as vertebral artery because it is passing through the vertebral foramina there, right? The vertebra has got transverse process has got foramina there. So it is passing through that foramina of the vertebral column. So it is called as vertebral artery. So the next artery is called as vertebral artery, right? So I will make a note here that the next artery is the vertebral artery which ascends up. Vertebral artery which ascends up. Okay. Third important thing is that here it gives, the first branch gives out a third important thing that is called as a trunk. So this trunk is called as thyrocervical trunk. Why it is called thyrocervical trunk? Because it supplies your thyroid gland, it supplies your cervical region. That is why it is called as thyrocervical trunk. And where is your thyroid gland located? Let us say your thyroid gland is here, somewhere here, right? And where is your subclavian artery? Your subclavian artery is here. So it means from this subclavian artery there is an artery that is going up like this and supplying to your thyroid gland, right? So look here. Let us say that, let me draw it over here itself. Okay, let me draw it over here, that this is your thyroid gland. Let us say this is your thyroid gland here. I mean, I'm not telling you thyroid gland is located on top of C6, but I'm just showing it to you because there is no space here, that we have got thyroid gland here. Now this trunk here is called as thyrocervical trunk. This trunk here is called as thyrocervical trunk. Thyrocervical trunk in the sense it gives two branches, I told you, right? So look here, one branch goes all the way and supplies to your thyroid gland like this. So it is supplying from the inferior surface of the thyroid gland below the thyroid gland. So can I call it as inferior thyroid artery? Yeah. Next important thing is that there is another branch, that is cervical branch. It goes transversely like this and supplies in the region of the neck. So this is called as transverse cervical artery. Okay. So look here, the third important one is thyrocervical trunk. Thyrocervical trunk. And this thyrocervical trunk has got two important branches. Okay, what are those two important branches? One is called as inferior thyroid artery. One is called as inferior thyroid artery because it supplies to the inferior surface of the thyroid gland, and the other one is called as transverse cervical artery. Transverse cervical artery. Okay, so there are two important things. One is called as inferior thyroid artery, another one is transverse cervical artery. Transverse cervical artery. Next important thing is that let us discuss about the second branch. So we are done with the first part. First part has got three branches. One is internal thoracic, another one is vertebral artery, next is thyrocervical trunk. Thyrocervical trunk means thyroid and cervical, inferior thyroid and transverse cervical. Next important thing is we will be discussing now regarding the second part of this discussion, I mean second part of this subclavian artery, the branch is called as costo-cervical trunk. The next branch is costo-cervical trunk. Costo-cervical trunk in the sense, costo in the sense it supplies to the ribs, cervical in the sense again it supplies to the cervical region. So previously we discussed it is transverse cervical, right? Now it will be ascending cervical. Okay, it will be ascending cervical artery. Okay, this is the second part. Now coming to the third part. What are the branches of the third part? There is only one branch over here. So on the third part here we have got a branch. This branch from the third part is called as dorsal scapular artery. Right? The third part is giving a branch and that is called as dorsal scapular artery. Dorsal scapular artery, right? So these are the branches which you have to remember for your exams, right? So these are the branches of the subclavian artery. Okay, so we have got the branches from the first part, we have got the branches from the second part, as well as the branches from the third part. Okay, so if you remember this, then most of your MCQs in the exam will be solved, guys. Okay. So guys, now we shall be discussing mainly about the veins of your upper limb. Okay, so we shall be mainly focusing on about the veins of your upper limb. Now when I discuss about the veins of your upper limb, few important things you need to know. What are those few important things? Are that this is the dorsal surface of your hand. Okay, this is the ventral surface. So this will be your dorsal and this will be your ventral surface. So here you have got a vein, here also you have got a vein. Now this vein on the thumb region is called as dorsal because it is on the dorsal side, digital because all these are the digits, right? Dorsal digital vein of your thumb. Now when it comes to little finger, here it will be dorsal digital vein of your little finger. Okay, so here you have got a vein like this. This vein is called as dorsal digital vein of your thumb. There are actually two. Okay, next here also on the little finger also you have got a vein. This is called as dorsal digital vein of your little finger. And next important thing is that you have got metacarpal veins. So where are these metacarpal veins, guys? Look here. Where are these metacarpal veins, guys? See, these are the metacarpal veins. Okay, so from the fingers, the metacarpal veins are draining inside like this, in this way. Okay, so what are the veins which you have here? The first thing on the thumb is the dorsal digital vein of your thumb. Okay, next important thing is that we have got dorsal digital vein of the little finger. Third important thing is that we have got dorsal metacarpal veins. We have got dorsal metacarpal veins. Okay, there are actually three. I have just drawn two, but there are actually three. So all of these veins, where do they drain? They drain onto dorsal venous arch. Look here. All of these veins, they drain into an arch like this, which is located here. There is an arch that is located here. So this arch is called as a dorsal venous arch. Okay. So this arch which I have drawn here, all of them, they drain into dorsal venous arch. Okay. Now this dorsal venous arch in turn gives rise to two veins. Now what are these two veins? Look here. On the lateral side you have got a vein. That is going up like this. Right. So this vein which is going on the lateral side is called basilic vein. On the medial side also it gives out a branch like this. This is called as cephalic vein. So there are two veins that are coming out of this dorsal venous arch. Okay, this dorsal venous arch is giving rise to two veins. What are those two veins? On the lateral side, this is called as basilic vein, Basilic vein, and on the medial side you have got cephalic vein. You have got cephalic vein. Now the basilic vein goes all the way up like this. Look here, the basilic vein goes all the way up, and then see, look here, the basilic vein is coming all the way up and then it is turning and coming onto the ventral side. But whereas look at the cephalic vein goes all the way up, and in the distal region only it will turn back, it will enter into the ventral side. Okay. So here itself it will enter onto the ventral side. Now on the ventral side if you look, what is this vein here which is going up? On the medial side, from the medial side, this is called as your cephalic vein. This is called as your cephalic vein. Okay. Next, there is another vein that is going up like this. What is this vein called as? This is called as basilic vein. This is called as basilic vein. Okay. Now, this cephalic vein and basilic vein, they will continue upward like this. They will continue upward like this. Okay. But what will happen is that in the middle in the sense in the cubital fossa here. So, cephalic vein is coming like this going up. Basilic vein is coming like this and it is going up, but in the middle region what will happen is that there is a connection that will be established between the cephalic vein as well as the basilic vein. Look here now, the cephalic vein as well as the basilic vein, both of them will meet together in the middle. So this meeting point is called as median cubital vein. This meeting point is called as median cubital vein. This meeting point is called as medial cubital vein. Medial cubital vein. Now from this medial cubital vein, now there is a small vein that is coming down. From this median cubital vein, you see a small vein that is coming down like this. Right? Now this vein which is coming from the median cubital vein all the way down, this is called as the median vein of the forearm. What is this called? This is called as median vein of forearm. So basically, where do you do all these blood transfusions or IV blood withdrawals and all? You basically do either for the cephalic vein or the basilic vein or the medial cubital vein. Right? Now, what will happen is that, guys, basilic vein is there, right? So this basilic vein, it continues up like this, right? And now look what is happening. Basilic vein directly drains into this vein here. This is called as axillary vein. Basilic vein is directly draining into what vein here? This is called as axillary vein. Axillary vein. Then what about the cephalic vein? Look here what will happen with the cephalic vein. Now what will happen with the cephalic vein is that here what is the muscle, guys? This muscle is called as your biceps muscle. So let me draw the biceps here. Okay, in the center here you have got biceps muscle. Okay, next what is the muscle on the shoulder here? This is called as your deltoid muscle. So let me draw that this is the deltoid muscle. Okay, next what is the muscle in the chest region? This is called as your pectoralis major muscle. Right? So let me also draw a muscle all the way like this. This muscle over here is, okay, let me rub out this axillary vein. So this muscle over here is the pectoralis major muscle. This is the pectoralis major muscle. Okay. Now look what is going to happen. What is going to happen is that this is your deltoid. Okay. And this is your biceps brachii. This is your pectoralis major. What will happen is that this cephalic vein passes lateral to biceps brachii, right? It is passing lateral to biceps brachii. Second thing is that this vein passes above and enters into a groove. What is this groove? This groove is present between deltoid as well as pectoralis major. This is called as deltopectoral groove. So this groove which I am shading it with yellow color here, this is called as deltopectoral groove. So this cephalic vein passes through this deltopectoral groove. Now once it passes through this deltopectoral groove, this cephalic vein here, it will pierce a fascia. It will make a hole in the fascia and then it will continue. Look here. It will make a hole in the fascia. I will tell you what is the name of the fascia. And then what will happen? Look here. It will make a hole in the fascia and then come out, and then finally it will drain into your axillary vein. This is how it is draining into the axillary vein. Okay. So what is the course of your cephalic vein? Cephalic vein passes above, right? It passes lateral to, let me also write these words. It passes lateral to this biceps brachii. After that it passes in between the deltopectoral groove. It passes in between the deltopectoral groove. Then it will pierce the clavipectoral fascia. Clavipectoral fascia, and then finally it will drain into your axillary vein. So this is the course of cephalic vein over here, right? Right. Next important thing, this is the venous supply, right? This is the venous supply. Now all these veins which I have discussed, all these veins so far which I have discussed are called as superficial veins. Okay, all these are called as superficial veins. Now in these superficial veins, we discussed that there is a vein called cephalic vein. We have discussed about cephalic vein. We have also discussed about let us say basilic vein, and the connection between cephalic and basilic is median cubital vein. Median cubital vein. Now this is cephalic, this is basilic, and this is median cubital vein. Now when it comes to the cephalic vein, so what are the uses of this? So what are the uses of cephalic vein? Cephalic vein basically we use for hemodialysis. Right, for any kind of dialysis we use cephalic vein. Okay, so cephalic vein is mainly used for hemodialysis. Keep this thing in mind, this can be an MCQ. Basilic vein is mainly used for cardiac catheterization. It is used for cardiac catheterization. Okay, next important thing is the median cubital vein. And why do we use this median cubital vein? Median cubital vein is mainly used for IV injections. IV injections and also withdraw blood. To withdraw blood as well as IV injection, right? Now why median cubital vein is used mostly? Because it is superficial. That is the reason why it is used, right? So these are the three important things you need to know. Right, now if we look about the lymphatics of the upper limb, the lymph nodes of your upper limb. So what will be the lymph nodes of your upper limb, guys? Let us look at the lymph nodes of your upper limb. Now in this lymph nodes of your upper limb, few important things you need to know. Let us say this is the shoulder, then we have got the forearm like this, then we have got the arm. Okay, right, so here we have got your clavicle. Here you have got your clavicle. Now look here very carefully. Now first important thing is that the upper limb lymph nodes are divided into two groups. Now one is called as the superficial lymph nodes, another one is called as the deep lymph nodes. So they are divided into two groups. One is called as the superficial lymph nodes, another one is called as the deep lymph nodes. Okay, we have got the superficial lymph nodes as well as the deep lymph nodes. Now first of all we will discuss about the superficial lymph nodes. Now coming to the superficial lymph nodes, you have got two superficial lymph nodes just below your clavicle. You have got two superficial lymph nodes just below your clavicle. And where are they located? They are located on the clavipectoral fascia. So here we have got clavipectoral fascia, all of you know that. Right, what is the clavipectoral fascia? The fascia that is present between clavicle and pectoralis minor is called as clavipectoral fascia. Right, so I have discussed in very much detail about clavipectoral fascia, so please watch that video, okay, before you watch these lymph nodes. So, and even watch the veins of the upper limb also before watching this video. So just below the clavicle we have got lymph nodes. There are actually two or three. So these lymph nodes here, these are called as infraclavicular lymph nodes. infraclavicular nodes. Okay, and where are they located? These infraclavicular nodes are located on the clavipectoral fascia. Clavipectoral fascia. So I told you that there was a vein that was going up. Now what was this vein that was going up, guys? This vein is called as basilic vein. This was called as basilic vein. And I also told you that there is also another vein that is going from the lateral side. This is called as cephalic vein. Okay, basilic vein, cephalic vein, together they will join and form median cubital vein. So we are not discussing about that. Okay, now what we are important to discuss here is that now this basilic vein goes up, right? And what did I tell you? Basilic vein directly drains into a vein here. This is called as axillary vein. This vein here is called as axillary vein, right? So again I'm telling you, this vein over here is called as axillary vein. So the basilic vein, it drains into the axillary vein. Now this cephalic vein goes up like this, right? Cephalic vein goes up and all the way it drains now into your axillary vein. So this is the thing which we already talked. Now why I am telling you this again is that if someone asks you where are infraclavicular nodes, what is the relation of infraclavicular nodes? The relation of infraclavicular nodes is, first thing is that they are located on the clavipectoral fascia, and next thing is that, look here guys, these infraclavicular nodes are very nearer to which vein here? They are very nearer to which vein here? They are very nearer to the cephalic vein, right? So can I tell these infraclavicular nodes are along the cephalic vein? They are along the cephalic vein. Okay, the question which they will be keeping on asking you in your exams is that, so what does these infraclavicular nodes drain? They basically drain the thumb finger, and they also drain the upper part of the breast, as well as the thumb finger. So these are the two things that are drained by these infraclavicular nodes. Okay, next important thing is that I already told you that here we have got a muscle called as deltoid muscle. I already told you that here we have got another muscle, right? The chest muscle. This is called as pectoralis major. Between the deltoid and pectoralis major, there is a groove called as deltopectoral groove. So in that deltopectoral groove also, here we have got lymph nodes. These are called as deltopectoral nodes. So the second group of lymph nodes, superficial lymph nodes, we shall be discussing is the deltopectoral nodes. And where are they located? They are located in the deltopectoral groove. They are located in the deltopectoral groove. Next important thing is that, you know, in the arm here we have got medial epicondyle, we have got lateral epicondyle. Just 5 centimeters above the medial epicondyle, here we also have a group of lymph nodes just 5 centimeters above the medial epicondyle. It means if this is lateral epicondyle, here this is medial epicondyle, just 5 centimeters above, in the sense exactly here we have got lymph nodes. Okay, exactly here we have got lymph nodes like this, and they are along the which vein, guys? They are along basilic vein, right? So I told you that this is cephalic vein and this will be basilic vein. So they are along the basilic vein, right? So these lymph nodes are called as superficial cubital, because this is cubital fossa. Above the cubital fossa you have these lymph nodes, so you call it as superficial cubital or supratrochlear lymph nodes. Okay, the next group of lymph nodes are superficial or supratrochlear nodes. Okay, and where are they located? They are located along the basilic vein. They are located along the basilic vein, and not only that, they are 5 centimeters above medial epicondyle. 5 centimeters above your medial epicondyle. Right. So what are the lymph nodes we have discussed so far? We have discussed infraclavicular nodes, We have discussed deltopectoral nodes. We have discussed superficial or supratrochlear nodes. So these three lymph nodes, they come under the superficial lymph nodes. Now when it comes to deep lymph nodes are your axillary lymph nodes. Deep lymph nodes are your axillary lymph nodes. Now what are the group of axillary lymph nodes we are going to see? Okay, but one thing I'm telling you, that lymph nodes are divided into two groups, right? But anyways, at the end I will write all of them, don't worry about that. So coming to the axillary lymph nodes, I'm not drawing much about I'm not detailing anything about the picture. I'll just draw a simple picture over there. So this is called as your clavicle, and here you have got your coracoid process, right? Coracoid process of your scapula, you know that. Now from this coracoid process, what is the muscle that is coming out? This is called as your pectoralis minor muscle, right? So this muscle is called as your pectoralis minor muscle. Okay, and next important thing is that this is the vein called as basilic vein. What did I tell you in the starting? Basilic vein, all the way it will drain into which vein here? Basilic vein will drain into axillary vein. Let us say this is the axillary vein. So axillary vein is passing all the way like this. Axillary vein is passing all the way like this, right? Next important thing is that, so we have got two branches of this axillary vein actually. So what are these two branches are? So this is one branch of axillary vein and this is another branch of axillary vein. So what is this branch of axillary vein called as? This branch of axillary vein is called as subscapular vein. Subscapular vein. Next, this branch is called as lateral thoracic vein. Lateral thoracic vein. And obviously this is your basilic vein, right? This is your basilic vein. So basilic vein is draining into axillary vein, and two branches, subscapular and lateral thoracic vein, are the branches of axillary vein. So this is entirely the axillary vein. Now let us look at the lymph nodes here. Now what are the different types of lymph nodes? First important thing, you will see a group of lymph nodes that are located along this vein. Now what is this vein here? What is this vein? This vein is called as lateral thoracic vein. So the first group of lymph nodes, where are they located? They lie along lateral thoracic vein. They lie along lateral thoracic vein, and these lymph nodes are called as anterior or pectoral lymph nodes. These lymph nodes are called as anterior or pectoral lymph nodes. Okay, now let us look at the second group of lymph nodes. Now the second group of lymph nodes, these lymph nodes, they actually lie along the subscapular vein. Where are these lymph nodes lying? These lymph nodes are lying along the subscapular vein. Okay, so the next group of lymph nodes, they lie along subscapular vein. Now look at the picture there, guys. Look at the picture. One is anterior, where the anterior group, I mean this one, where exactly near the lateral thoracic vein, these lymph nodes are anterior. So in back of that, where they are lying along with the subscapular vein, so they will be posterior. So these lymph nodes are called as posterior or subscapular lymph nodes. Subscapular lymph nodes, posterior or subscapular lymph nodes. Third important thing. So third group of lymph nodes, they will lie here. Right? So where are they lying? They are lying along the axillary vein. Where are they lying? So third group of lymph nodes, they lie along axillary vein. Axillary vein. So these group of lymph nodes, they are called as lateral group of lymph nodes. They are called as lateral group of lymph nodes. Okay? Right. Next important thing. Next important thing is that we have got a group of lymph nodes exactly in the center here. Exactly in the center, we have got a group of lymph nodes. So these group of lymph nodes are called as central lymph nodes because they are exactly located in the center. Next important thing is that you have got a group of lymph nodes along the superior part of the axilla. Right? So this is the superior region of the axilla here, right? So this is the superior region of the axilla. You have got a group of lymph nodes in the superior region of the superior part of the axilla. These are called as apical group of lymph nodes. So these lymph nodes will be called as apical lymph nodes. These are called as apical lymph nodes. Okay, they are along the axillary vein. They are where? They are along your axillary vein.